like we are going to study the anatomy of tibia and fibula bone of canines. Tibia is a long bone and it is the larger weight sporting bone of dogs, whereas the fibula bone sports minimal weight. Tibia contains two extremities, one is the proximal extremity and other is the distal extremity. In between these two extremities, a long body is present. The proximal part of the tibia gradually becomes wider, and this proximal part is wider than the distal end of femur with which it articulates in order to form the stifle joint. So this proximal end of the tibia articulates with the distal end of femur in order to form the stifle joint. And if we look at the body of tibia, then the body of the tibia gradually becomes wider as we move towards its proximal end. Now I am going to discuss the proximal extremity of tibia. In the proximal extremity of tibia, there are two condyles. One is the lateral condyle and other is the medial condyle. Here we have lateral condyle. This is the lateral condyle. In this picture, this is the lateral condyle. And in this picture, this is the lateral condyle. And similarly, here we have medial condyle on the medial side of tibia bone. So here we have medial condyle, and in this picture, here we have medial condyle. You can see that lateral condyle is more prominent and it has a facet where head of fibula articulates. This region is for placement of facet, and it is present on lateral condyle. Here facet is present. So this facet helps in the articulation of the head of fibula. Now on this lateral condyle, a sesamoid bone which is present in the tendon of origin of popliteus muscle articulates with this condyle of tibia. It means that with this condyle of tibia, a sesamoid bone articulates, and that sesamoid bone is actually present in the tendon of origin of popliteus muscle. As I have told you that the proximal end of tibia forms stifle joint with the distal extremity of femur. So there are two menisci between the condyles of the femur and the condyles of tibia, and these menisci are called lateral meniscus and medial meniscus. A meniscus is actually a fibrocartilaginous structure, and both menisci help to absorb the shock and decrease the friction between the femur and tibia uh, in the stifle joint. Now on the proximal extremity, there is an intercondylar eminence which contains small elongated tubercles, and this intercondylar eminence is present at the caudal aspect of uh, tibia bone. So in the proximal extremity, this intercondylar eminence is present. And as you can see in the picture that this intercondylar eminence contains small elongated tubercles, these small elongated tubercles. So this is the intercondylar eminence. Now just cranial to this intercondylar eminence, there is a shallow region called a cranial intercondylar area. This is the cranial intercondylar area as it is present just cranial to this intercondylar eminence. And similarly, just caudal to this intercondylar eminence, we have caudal intercondylar area. So it is present just caudal to this eminence, and it is not much prominent in this picture. Although the cranial intercondylar area is much prominent as you can see here. Now keep in mind that these both cranial intercondylar area and caudal intercondylar areas are shallow areas, and these are non-articular areas. Now just caudal to this caudal intercondylar area here, just caudal to the caudal intercondylar area, a popliteal notch is present. This notch, as you can see in the picture, this notch is called popliteal notch, and as you can see that it is located between the two condyles. It is called popliteal notch because the popliteal vessels pass from this point, so we call it popliteal notch, and it is present just caudal to the caudal intercondylar area. Now the other point is the tibial tuberosity, which is continuous with the cranial border of tibia. This is the whole is the cranial border of tibia, and here we have tibial tuberosity. So as you can see in the picture that this tibial tuberosity is continuous with the cranial border of tibia, and it is also inclined laterally. As you can see, it is inclined laterally on the body. Another structure is which is present in the proximal extremity of tibia is the extensor groove. This is the region for extensor groove, and this groove is actually small and a smooth groove, and it is located at the junction of lateral condyle and tibial tuberosity. So as you can see that this is the junction of the lateral condyle and tibial tuberosity. Here this is the here you can see that this is the tibial tuberosity, and this is the lateral condyle, and the area of junction between these two, this area this area is called extensor groove. So this is about the proximal extremity of tibia. Uh, let's repeat it. As you can see here, here we have lateral condyle. This is the medial condyle. So this is the tibial tuberosity, and the area between these two is the extensor groove. This is the extensor groove, this area. So this is the lateral condyle, extensor groove, tibial tuberosity. This is the medial condyle, and similarly, this is the popliteal notch. This is the popliteal notch. This is the cranial intercondylar area. Here we have caudal intercondylar area, and this is the intercondylar eminence. Here intercondylar eminence. So this is about the proximal extremity of tibia. Now let's talk about the body of tibia. As I have told you that body of tibia is wider as gradually becomes wider as we move towards its proximal extremity. So the body is triangular in shape. This is triangular in shape at its proximal end and nearly cylindrical in its middle, and distally it is four-sided. So as you can see that proximally it is triangular, nearly triangular in shape, then it's in middle it is cylindrical, and then in the distal end it becomes four-sided, as you can see here. Now let's talk about the distal extremity of tibia. The distal extremity of tibia contains tibial cochlea. This is the tibial cochlea, which is an articular surface, and there are two grooves. These are two grooves which receive ridges of trochlea of talus bone. So these grooves receive the ridges of trochlea of talus bone. Now there are medial medial and lateral malleolus, and malleolus is a bony projection with a shape just like hammerhead. So on the medial side there is a medial malleolus, and similarly on the lateral side there is lateral malleolus. As you can see here, this is the medial malleolus and this is the lateral malleolus. This whole is the lateral malleolus. This lateral malleolus articulates with the fibula by a smaller facet which is present here. So here it has a facet for articulation with the fibula bone. This was all about tibia. Now let's come to the fibula bone. Fibula is also a long bone having a proximal extremity, distal extremity, and between these two extremities there is a body. The proximal extremity of fibula has a head. This is the head of fibula, which actually articulates with the lateral condyle of tibia bone. So proximally the head articulates with the tibia, and similarly the proximal extremity of fibula also contains a lateral malleolus. So two structures are present in the proximal extremity of fibula. One is the head that articulates with the lateral condyle of tibia bone, and the second structure is the lateral malleolus. If we talk about the distal extremity of fibula bone, then at the distal extremity there is a facet. This is the facet on the distal extremity, and this facet is present actually on the medial side of fibula bone. The function of this facet is in articulation with the distolateral surface of tibia and talus bone. It means that this facet, which is present on the medial side of fibula bone, articulates with the lateral side of tibia bone on the facet which is present on the on this lateral side. As I have told you that this lateral side also contains a facet, so this facet articulates with the facet which is present on the distal extremity of fibula bone. And similarly this fibula bone also articulates with the talus bone distally, which is present just distal to the tibia fibula bone. The talus bone is actually a bone which is present in the tarsals of a dog. So distally it articulates with the talus, and it also articulates with the tibia bone here. So this was all about tibia and fibula. Thank you.